If you clicked on this video, you're probably feeling exhausted, overwhelmed, or just off. Maybe you can't tell if you're burned out from work, dealing with depression, or struggling with anxiety. And honestly, the fact that you can't even tell the difference isn't your fault. These three conditions share so many symptoms that even professionals sometimes get it wrong initially. But here's why it matters. I spent 6 months treating what I thought was depression with lifestyle changes and therapy, and nothing was working. Turns out I was just burned out. The moment I addressed the real issue, everything changed within weeks. And today I'm going to show you the exact difference between depression, anxiety, and burnout, and not just the symptom everyone's talking about, but the key distinguishing factor that separates them. Because getting this wrong means you could waste months or even years trying to fix the wrong problem. I will also give you one simple question at the end that can immediately tell you which one you're likely dealing with. Now, before we start, I'm not a doctor and this is not a medical advice, and you should always consult with a professional whenever it comes to these kind of things. But being a nursing student and someone who's recently went through this phase just past few months ago, I've dove deep into the clinical research and spoken with licensed professionals to understand what really separates these conditions. What you're getting here is a practical framework from someone who's been where you are right now, plus the specific language to use with the professionals so you can get the accurate help faster. Here's what nobody tells you. Misdiagnosing yourself doesn't just waste time, it can actually make things worse. When I thought I was depressed, I focused on things like gratitude journaling, meditation, and talking about my feelings. And all good things, but completely useless for burnout. Burnout needs you to set boundaries and remove stressors. Depression might need medication or trauma therapy. Anxiety requires learning to manage worry and fear responses. Try to treat burnout like depression and you'll end up more frustrated because nothing's working. And here's the kicker. These conditions overlap so much that even professionals struggle to distinguish them initially. And that's not because doctors are bad at their jobs. It's because these conditions genuinely overlap that much. But there's one question that can cut through all the confusion, and I'll share that with you at the end. First, let's break down what each of these even look like. Let's start with burnout because this is probably the most misunderstood one. The World Health Organization officially recognizes burnout as an occupational phenomenon, and that word occupational is key. Burnout has three main components: emotional exhaustion, specifically related to your work or your main life stressor. Second, cynicism or detachment from that same area. And third, a reduced sense of accomplishment in that specific domain. Here's what burnout feels like in real life. You wake up dreading work, but you're fine hanging out with friends on weekends. You used to care about doing good work. Now you just want to get through the day. You feel competent in other areas of your life, but at work, everything feels impossible. The key thing about burnout, and this is crucial, is that it's situational. Remove the stressor and you start to feel better. Take a vacation from your toxic job and you actually enjoy yourself. That's burnout. When I was burned out, I could still laugh at funny videos, memes, enjoy meals with friends, and feel excited about my hobbies. But the moment I thought about work or opening my goddamn laptop, this crushing weight would hit me. That's not depression. That's your brain telling you something is fundamentally wrong with your environment. Depression is different. It doesn't care about your circumstances. It affects everything. Clinical depression involves persistent low mood or loss of interest that impacts multiple areas of your life for at least 2 weeks. We're talking about sleep changes, appetite changes, feeling of worthlessness, difficulty concentrating, and sometimes thoughts of death or suicide. And here's how you know it's depression and not burnout. Even when you're away from the stressor, the symptom still persists. Let's say you're on vacation at your favorite place, your dream place, but you still can't seem to enjoy it. You're with people you love, your family, your better half, your partner, but you still feel disconnected. Food doesn't taste good, the things that used to make you happy doesn't do it anymore. That's depression. And I got friends that describe depression as wearing gray tinted glasses. Everything looks muted and hopeless, regardless of what's actually happening around them. It's not situation, it's pervasive. Depression also tends to come with what psychologists call the cognitive distortion. Your brain starts telling you stories that aren't even true. I'm worthless, nothing will ever change, I'm a burden to everyone. With burnout, you might think this job sucks, but you don't usually think I suck as a person. And here's something important. Depression can be triggered by burnout. Chronic stress from your work or your life can literally change your brain chemistry so much so that it starts as a situational burnout but becomes a clinical depression. That's why the timeline matters. Now, anxiety. This one's all about fear and worry, usually focused on future events or potential threats. Anxiety disorders involve excessive worry that interferes with your daily life. We're talking about physical symptoms like racing heart, sweating, muscle tension, plus mental symptoms like catastrophic thinking, difficulty concentrating, because you're worried, and avoidance behaviors. And this actually happened with me. I actually had a kind of like a panic attack and this was a time when I just woke up in the morning. I went to the toilet, I was sweating, my chest hurts, I can't think properly. I don't know what happened that day. I was probably worried about something. My life wasn't going great. It was pretty scary. And here's the key difference. Anxiety is fear-based, while depression is sadness-based. And burnout is exhaustion-based. Three different things. With anxiety, your brain is constantly scanning for problems that aren't even there, playing out worst-case scenarios and just thinking about what if about everything. And I mean every single thing. Someone with anxiety might avoid social situation because they're worried they might be judged. Someone with depression might avoid it because they feel too empty or they feel worthless. And someone with burnout might avoid work situation but be completely fine socially. I've dealt with anxiety periods like there's like 100 different tabs open and all playing different disaster scenarios. What if I fail this exam? What if my family gets sick? What if I said something stupid in the conversation? It's exhausting, but in a different way than burnout exhaustion. The physical symptoms, like I talked about before my panic attack, it can be really intense too. It felt like it grabbed my heart. It felt so bad. I was sweating in the morning in the winter. You feel like you can't breathe, nausea, dizziness. You feel like you're gonna fall down. It's blurred. It's crazy. Your body is responding to threats that aren't even there. Now here's where it gets tricky. These three conditions love to show up together or mimic each other. Chronic burnout can lead to depression. When you're stuck in a terrible situation for months or years, your brain chemistry can actually change. And what started as situational burnout can actually lead to clinical depression. Anxiety and depression are best friends. They often come as a package deal. You worry about everything going wrong. Then you feel hopeless about handling anything. Or you feel depressed about your life, which makes you anxious about the future. And sometimes you get the perfect storm. All three. You're burned out from work, which triggers anxiety about your performance and which leads to depression about your life situation. Fun times. This is why it's so crucial to work with a professional who can help you untangle what's what. Alright, here's the question I promised you earlier. And it's simple but powerful. If the main stressor in your life was completely removed tomorrow, your toxic job, your difficult relationship, your financial pressure, would your symptoms disappear too? If the answer is yes, you're probably dealing with burnout. If the answer is no, if you still feel hopeless, empty, worthless, even without the stressor, you might be dealing with depression. For anxiety, ask this. Are your worries mostly about a specific situation or potential future problems? Or is there a general sense of dread and fear that doesn't have a clear target? Specific worries such as situational anxiety, general dread might indicate an anxiety disorder. And here's a quick self-assessment that you can do right now. I'm just going to put them on screen. I'm not going to go through every single thing, otherwise this video will be crazy long. Just pause and try it. Now here's what to do with this information. First, if you're having thoughts of self-harm or suicide, please reach out for help immediately. If you think you're dealing with burnout, start by addressing the environmental factors. Can you set better boundaries? Take time off? Have conversations about workload. Sometimes burnout can be resolved by just changing the situations. If you suspect it's depression or anxiety, please talk to a healthcare provider. Here's exactly what to say. I've been experiencing specific symptoms for this certain time and it's interfering with this specific area of my life. I would like to explore whether this might be depression or anxiety and discuss treatment options. Don't just say, I think I'm depressed. Give them specifics. I've been feeling hopeless and empty for 3 weeks. I'm not enjoying things I used to love, and I'm having trouble getting out of bed. That gives him something concrete to work with. And remember, all these conditions are treatable. Burnout, depression, and anxiety all respond well to appropriate interventions. You're not broken, you're not weak, and you don't have to suffer in silence. And look, I'm not going to sugarcoat this. The world can feel like a pretty difficult place right now. We're dealing with more stress, more uncertainty, and more pressure than the previous generation. It's actually no wonder so many of us are struggling with these disorders. But here's what I want you to know. You're not alone in this. The fact that you're here trying to understand what you're going through shows incredible strength, and that matters. I want this to be a safe place where you can talk about and be vulnerable. If this video helped identify what you're dealing with right now, drop a comment and let me know. Share your experience if you're comfortable. Sometimes just putting it into words just helps. It helps a ton. And it might help someone who's going through the same thing. And not everyone in this world is going to understand what you're going through. Let me be clear here. But there are people who do. There are people who care, and the help is available. If you found this helpful, please share it with someone who might need it. And subscribe for more content about mental health, productivity, and just self-care. And remember, seeking help isn't giving up. It's just taking back control. Take care of yourself, and I'll see you in the next one. Bye.